Hello, everyone, and welcome back to TruthIn.Health podcast. Today, we're very lucky to have with us Paula Yockel, who is with Mission 503 nonprofit. And Paula is here to tell us all about what Mission 503 is. But welcome to the podcast, Paula. It's a pleasure to have you today.
Good morning. Thank you so much for having me. I'm glad to be here. It's an important subject that affects all of us, and I just appreciate the opportunity to talk about it.
Very good. Very good. Do you want to start off and tell us a little bit about kind of the origin story here? What piqued your interest into this cause? How'd you get started, I guess, with everything?
Well, to start off, Mission 503, we have founded it, and our overarching objectives is to stop the land disposal of our nation's sewage nationwide and to lead the way to new infrastructure solutions that properly manages sewage solids. We don't currently have an infrastructure to properly manage sewage solids, and that is one of our larger obstacles we've got to overcome, but I believe it can be done.
And is this what you'd call, or people are calling, let's say, biosludge? Is that kind of the same stuff?
Well, the marketed name is Biosolids, but yes, biosludge. Some folks call it human manure. I tend to call it sewage because that's what it is. But the marketed name through the EPA and the industry is Biosolids. And there's a very interesting story. It's called Toxic Sludge is Good for You, about how the PR industry really had to do a significant amount of work to make the idea of dumping our nation's sewage on our nation's farmland a good idea. And they were quite successful at it. Yeah. So there's a big background, even to know how we got to the word biosolids.
Yeah, it's amazing how, let's say big food, big pharma, big everything has, made all this horrible behavior okay with their PR and marketing campaigns. But this has affected you personally, right? So you had something happen. Tell us the story. So tell us what happened and kind of what got you involved.
Well, certainly my life's mission was not to handle the nation's sewage. My husband and I were looking for a place to live just outside of town so we could, have an acreage, build our dream home over time, that sort of thing, having no idea that we had just purchased land that was in the corridor where Oklahoma City dumps their sewage and had for decades. And it is per federal rule. This happens across the nation. This isn't an Oklahoma City issue. This is a nationwide problem.
Let's talk about the rule, because I think that's really important. And that's how, let's say, people are getting away with it. But so you moved into a situation that you were unaware of. Was it disclosed in your purchase documents or anything like that? Yeah.
No, it wasn't. It doesn't have to be. It is marketed through the federal rule, and it's the 40 CFR Part 503 is the federal rule. Hence, the name of our mission is Mission 503. With the 503 rule, deal with it in a way where we get to real solutions. Changing the rule, by the way, is meaningless without infrastructure to properly handle sewage solids. So when we bought our land, there's no disclosure. It is promoted by the EPA, by the industry. And so there's really no reason to disclose something that is promoted as fertilizer. Yes, it should be disclosed because it's sewage. Our city sewage, we identify local farms that are near the wastewater plants. These are sewer plants that, all municipal sewage goes through a process, goes through pipes, goes to plants where they separate the water from the solids. The water goes back into our natural waters or used on golf courses in other ways. Then the solids, they got to figure out something to do with it. Our entire wastewater system is about the water, producing a cleaner water to be reused, which is a good thing. It has to be done. The water, we've got to manage that water. All innovation, all processes are about the water, not about the solids. So when we separate them, the solids then get taken to farmland, to agricultural farmland. Some of our nation's food is grown on it. We have cattle grazing on it. We have beef and dairy cattle grazing on it. Sewage is getting into our lives in ways we have no idea about. But when it is dumped next to your home, that's a whole different situation.
Did your family have health problems? Is that how you kind of began to discover that there was something wrong, or what cued you to, hey, we've got raw sewage being dumped next door or whatever? Was it health problems?
Yes, it was. But ultimately, the first thing that you notice is the smell.
Okay.
And people just think smell is smell. Well, smell is actually molecules of all sorts of things, particulates, gases, vapors.
VOCs.
It's all of the above. And so, and I just need to say it's not classified as raw sewage. That's what's in the pipes before it hits the sewage plant. It's what comes out afterwards. So it's treated. Treated means we did something to it to separate the liquids and the solids. And then the federal rule requires some sort of attempt of reducing a fecal indicator. And it measures for 9 metals for approval, for it to be approved to go on farmland. They test for 9 metals and a fecal indicator, and that's it.
Okay.
And so that is considered treated sewage at that point. So since the beginning of municipal sewage, when we started having infrastructure to deal with sewage, early 20th century, late 19th century, we started having, municipal sewage. We've been dumping it on the ground forever. However, as population centers grew, larger cities grew, we started having more sewage. And we were dumping it in the oceans. We were dumping it everywhere. We got to a point where it was banned from being dumped in the ocean. There were contamination issues and natural streams and waters where it was being just dumped without any, regulation.
Yep.
And so the Clean Water Act happened. This is all sort of a third or fourth generation residual of the Clean Water Act. It's all about the water. There was not a well thought out plan for really the amount of sewage the nation was going to create and what we were going to do with it. So when we start dumping it on farmland next to people's homes, the first thing you encounter is odor.
Yeah. Okay. And about when did you begin to kind of clue into something's going on here next door? That you complained, right? You wrote some complaint letters and you took some action, but tell me kind of what prompted you to take that action, and then what was the action, and then kind of what happened as a result of the action that you took.
Well, we bought our place in 2004, both worked a lot. We weren't home that much. We were young professionals, traveled a lot. You would occasionally get the gust of stink in the air, and then the winds change as it does in Oklahoma. It goes away and you don't really know what's going on. It was not until about 2008 when we recognized on the land next door to our home trucks. There really is kind of like a convoy of trucks that shows up on the street, and they just pull onto the pasture and they start dumping it. It's like black, oozing, atrocious muck.
Okay.
And so that was the point. When I visually was able to see what was happening, I started making calls, trying to get meetings, writing letters, you name it. I called them. I contacted them. You're told, look, we've been doing this forever. It's not a problem. It's good for the soil. And this is what people are told across the nation. So you get responses from DEQ, from the city. I went to the wastewater plant. I really tried to get it stopped, because when it's happening next to your home, it can be 250 feet, your well. And
okay. Wow.
It's not really measured close to the home is not the point of measurement. It's close to a natural water source.
Because it's water. It's all about the water, as you said.
It's all about the water.
Yeah.
And not the air.
Yeah.
Not the people. When you start checking into it locally, like we did, you're really just told, look, this is a federal rule. It's treated. We were told at one time it was sterile. That just baffles me that we were actually told it was sterile at one point.
Just real quick on the, did you talk to your like state senator, state representative, any of the kind of legislative people, or did you get anywhere with those type folks?
You know, from the point when we first recognized it was what was happening, 2008 through 2015, let's try to make that a bundle to tidy up we talked to everybody. We talked to state politicians, U.S. senator offices. We spoke to regulators, EPA offices, agriculture offices, governor's offices. You name it, we've talked to them, met with them, delivered research to them. Really what happens is it's a finger pointing game, because ultimately we have a federal rule of the United States that says this is a good idea. I'm about going to the root of the problem. All of our work and all of our research is from 2008 to 2015. And now we didn't spend that whole time. Keep in mind, when you are living this, you do not know what you're living. You don't know that your sicknesses are from this. And maybe some of them are, but I'm telling you, some of them are.
Well, let's go right into what happened to you guys. So let's go right into
it. And I think the best way to explain is when it is dumped right next to your home, when it was dumped next to our home, you can be sick within hours. Especially when you're downwind. Climate matters, by the way. This is how disease is spread. It's basically when we were living next to sludge, especially in the winter, and cold, wet, foggy winters. It's like the earth is sneezing on you. We all know we don't want someone sneezing on us. Well, climate matters here. Fogs, moisture, wind carries everything that's in that sewage that's on the ground next to your home, carries it into your life.
Yep.
Across the fence, and it travels for miles, by the way.
Yep.
You're sick within hours. This is headaches, nausea, GI distress, eye infections, respiratory infections. You name it, when you are close to and downwind of sewage, you're getting hammered. And everything that's extracted from the culture, you're breathing it. And it's not just organisms, it's not just pathogens. It's VOCs, it's SVOCs, it's, all those solvents, it's vapors, it's particulates, it's, you name it, whatever is in sewage, you're breathing it. There's a reason they call it biosolids. Your brain does not conjure up some predetermined idea when you hear the word biosolids. It sort of sounds, this must
benign.
It sounds
benign. Yeah.
That's even in the book. That was how they chose. There was a contest when they named it. They went with that because there was no preconceived conjuring up of something negative. Well, when you live next door to it, it's a negative situation. This is sewage.
And you guys got some chemical evidence, right? You have some DNA evidence of what was going on, don't you?
Well, we do. From 2008 through 2015, we just kind of battled it locally. When it happened next to our home, we went through the same routine, calling officials, authorities, trying to set meetings, write all those things. Well, 2015 and 16 was a different story for us. In 2011, we'd gotten an agreement where they said, we won't dump it next to your home anymore, because I really was persistent. In 2015 and 16, the agreement was sort of forgotten, and they dumped next to my home again. But this time it was right next to our home and then up the street right after it. And so we were, over the course of, 2.5 months or so, we had weeks of sewage getting dumped upwind in the winter. The aerosols don't die down for months. And because you're not smelling something at a certain point doesn't mean you're not impacted. Some of the most dangerous things in sludge are odorless and invisible.
Yeah, BPAs would be a huge one.
So, and so at that point, we started calling, having meetings with everybody we could. And I started sharing research that I was finding. I would build binders and deliver them to 4 to 5 offices of authorities. This doesn't matter. But the amount of money we were spending just on making copies and building binders and distributing research is kind of mind-boggling.
Well, and I completely think that matters. I mean, it's really interesting when you're really passionate about something, you're willing to fight for it. And it really doesn't, we'll talk about your personal sacrifice. I know the personal sacrifice my wife and I have had to, endure to kind of get everything where we need it to be. But I can imagine that you've been through a lot of personal sacrifice.
Well, it's a choice. It's a choice. At that point in the winter of between, late 15 and 16, where I said, you know what, I have everybody telling me this is safe. I have everybody telling me this is the federal rule and this is just what we do. I have, research from across the nation where this is not a good idea. Mm-hmm. But I can't affect the conscience of my leaders with research out of Arizona, Ohio, Pennsylvania, New York, North Carolina, you name it. The research is there. People are sick, and they've been fighting this for decades. And so I said, we're going to test it ourselves. Let's ask for samples. All they can do is say no. Well, because it's just fertilizer, allegedly, we asked for samples, and we were given permission to send a lab in to get samples. We actually asked twice over the course of a year and a half or so. We sent a lab in and we got many, many, many liters of sludge right out of the sludge bin at the wastewater plant, shipped it all over the nation, and we went to work. I just wanted facts. We did not, in that moment, because we were so sick. I would go to meetings so sick. My clothes were actually falling off of me. I would have to safety pin my clothes on me because the weight loss that comes when you are breathing a toxic disaster is really unexplainable, what's happening to your body. Actually, it's very explainable. And so I was going through these meetings, but I said, you know what? We need samples. They let us have them. We just wanted local facts so we could go back to these local authorities and say, look, this is what you're asking us to breathe. This is what you're asking us, to deal with when you're dumping next to our home. That was our intent. But here's what happened. What we started learning was so wretched and so unbelievable. We kept testing more and more. Okay, well, it's in the solids. If it's in the solids, it's got to be coming off the solids. Let's do some air studies. Let's do some headspace studies. Let's grow this stuff. And by the way, antibiotic resistance is all in the research. Let's see if antibiotic resistance is growing on these farm fields, because we were getting just hammered in MRSA infections. Mm-hmm. And so I just started calling people I'd find in research. I'd call universities, top labs across the nation. I'd say, this is who I am. My family is severely harmed by this. I know it is from the sewage they're dumping next to my home. Are you interested in any testing with us? Because I've got samples. I've got them on hold at a lab. It's all proper chain of custody. I could get you some. You want to work with us? We had significant success in building alliances with top researchers across the nation, where we ultimately got to the point where we can say, to a very large degree, the federal rule is not telling the farmers the truth. Federal rule is only measuring for 9 metals and 1 fecal indicator. It's not measuring for a single pathogen. We were able to show disastrous harm as active in the sludge, pathogens, staph and strep.
Staph and strep, and again, that's what causes MRSA. So it's staph and strep that cause.
And MRSA. And we were able to do antibiotic resistant studies immediately upon land application, just up the street from our home, and 30 days later. We're still growing 3 of the 6 most deadly antibiotic resistant pathogens on these pastures 30 days after.
So what was growing? Do you remember what was growing?
You know what? I have it right here, if you don't mind me pulling it up.
Absolutely. I'm very
curious.
And
let me show you this. It's on my website. We've got it as organized as you can possibly get it when you're putting a lot of stuff out there. There's a page called Get Informed. If you slide about halfway down the page of the Get Informed tab, there's called a slideshow of key findings.
Mm-hmm.
That antibiotic resistance study is part of their key findings. I'm going to show you that slide there real quick, because really we didn't learn one key thing or a dozen key things. We truly learned probably 100 to 200 key findings. And
Well, and that's, I know from my work, if you look at really what's wrong with us, if you look at what's wrong with our society, our population as to health, it's two things. It's malnutrition and then it's infection. So
yeah,
we're a little malnourished. We get infected with these first line things, but it'll be interesting to see how many first line things are in your study. And that creates more malnutrition, which leads to more infection, which leads to more malnutrition, which leads to more infection. So almost every single disease maps back into that scenario. Let's say.
yes.
So what's in the sludge?
Well, and I'll tell you, after 30 days, the 3 antibiotic resistant organisms were Staphylococcus aureus,
Okay.
Acinetobacter baumannii, and Pseudomonas aeruginosa.
What was the middle one again? What was the middle one again?
Acinetobacter baumannii.
Okay. All right. And the last one?
Pseudomonas aeruginosa.
Okay. So that's a very bad, if you inhale that guy, he's going to form biofilms. Obviously staph is, there's a ton of stuff associated with staph and strep. I would imagine you have strep in there too. I would imagine you would have had E. coli, maybe some aspergillus, some funguses and things that they might not have tested for. But you're absolutely on the money. That, if you think about this, right? So let's say we're driving down the road and oh my gosh, we see that squirrel that got run over in our neighborhood, and it's very sad. We're sad about it, but we drive by the next day and that squirrel isn't quite what it was the day before. And we drive by the next week and that squirrel is pretty much gone, but the fur. And then we drive by a month later and that squirrel is gone, but a few little pieces of fur or whatever. So what happened to that squirrel? Well, he got decayed by earthly processes. So anything that's alive, when it stops moving electrons, let's say at a certain rate, or dies, it's going to attract all this pathogenic bacteria that's going to help break it down and break it down back into the things of the earth. So anything that has been alive, and certainly poop has been alive, is going to attract this bacteria. And this bacteria is going to stay alive in it until it's gotten every single nutrient that it can possibly get out of it. And that could be years and years and years for this stuff. So yeah, and again, we're exposed to this stuff. People come in my office all the time and say, well, how did I get this? Well, guess what? They're dumping it all over the place right next door to you. Tell me how this morphed into really the founding of, so you guys have been through this hell. When did you decide to really form up into a nonprofit and, try to help?
Well, I think there's a couple answers there. Number one, I'm a mama. Before we had our son, and I got pregnant right after that 2008 land application. My pregnancy, it was so sick. During my pregnancy, there were 6 additional land applications around us. Think about that for a second. And the vulnerability of a baby in the womb. We came very close to losing my son at birth because of the urgency my pregnancy was. We just dismissed it to, this is just how things happen in life. We had no idea how we were going to ultimately be able to connect the dots. The more we learned, I was protecting my family, me, my husband, and my son. Then I find out my neighbors, I started talking to my neighbors. They were having some of the same atrocious illnesses that we were. Then we started researching it. The more we learned, the more we had to try to poke holes in what we were learning because it was so outrageous. Mm-hmm. But I thought we got to make sure this is right, because you don't go out with something that's not right. It was not a linear process. There was 100 pathways going at one time. As we were learning across these multiple pathways, we got to a point where there was no turning back. We started studying the correlations between what we were finding in the sludge and what we were testing in the environment. And there was some real, statistically speaking, math doesn't lie. There was some real mathematical information and correlations coming out of what we were, just spreadsheets we were building.
Yeah. Again, this is, right up my alley. So that's what I study every day is,
Right.
how does environment, hurt you, and how can it hurt you, and how can you hurt by your environment? But yeah, you can't, again, if you've got a bunch of BPAs and you've got a bunch of pathogens, that are overloading your environment, there's ways that you could defend yourself, but it would be very hard with our current knowledge and all that. So it's almost impossible to defend yourself against some kind of health outcome if you've got that much stuff around you.
A lab experiment. When you live in these communities, I mean, I mapped active sites, pulling data out of the DEQ site, and it's also in that slideshow of key findings. That's really, if somebody wants to get to high level learnings, that slideshow of key findings on our Get Informed page, we map the sites that were active across the state. If there's a cluster of sites, that I consider that one community. There was 40 to 50 communities across the state.
Wow.
Take that across the nation. But I don't feel like I answered your question, which is so critical. How do we make a decision to do what we're doing? The knowledge that was coming out of our research, we couldn't turn our back on. Not only had we lived it, suffered it, each family member and my family had very close calls with our lives. Me from sewage parasites I had breathed, trying to take me down, and came very close to it. We could have lost my son a couple times, and we could have lost my husband's arm from skin infection to save his life. Praise God, none of those things happened. We were going through those things as we're researching. We ultimately started studying the health data. And I told my husband, if we start seeing disease clusters and we start seeing illnesses associated to what we know we are breathing, there is no going back on this deal. We gotta go. We gotta go as far as we can, because I cannot turn my back on the suffering. We will not do it. We have thrown, we changed direction of our lives. I had started a small business. I had developed products. I was ready to launch my own business. We canceled life, continue pursuing, because we just started out for facts to represent what we were experiencing to local officials. But the more facts we learned, the effect we saw in the community, we decided we got to go after the root of the problem. And that is the federal rule. It's not the industry. They have a role in this. There's a lot of marketing that's put out on this, paid for by the government and by the industry. But the bottom line is we have a federal rule that promotes this, that deceives our farmers, that is harming Americans. We dump our nation's sewage where millions of Americans live, but we want to make America healthy again. Those two things are incompatible.
Completely agree with you. So let's talk a little bit about, you guys had to move, right? You had to move.
Well, we did. We kind of abandoned our home. My husband stayed a couple years behind us. It was our home. I took my son to my mom's house. Every time we'd try and go home, our defenses were so hammered at this point. Every time we would try and go home, same illnesses. It was, and I said, enough. I am not putting my son through this. Will not risk him. I am not risking his mommy, meaning me. And at a certain point, and my husband continued getting infections and skin infections. We're leaving it. We left it. It was our closet. We were in it. My husband would go mow it. We still took care of it. We wanted to be a good neighbor, but we left our home far before we had a neighbor offer to buy it from us. We could not, in good conscience, list our place, invite some family to live on our beautiful land, knowing that it made us sick. Mm-hmm. So we held on to it for a very long time. A very generous neighbor who also has sludge dumped right across from his home offered to buy our place because he knew our research. We fully disclosed everything, to him. Yeah. But we had already gone public with our mission, our website. It was out there. But we had a very generous and kind neighbor offer to buy our place, because we would have never been able to buy another home. We had every extra penny we had went to our medical bills, paying for life, trying to keep our son's life as normal as we possibly could, because his life was always in upheaval with what we were going through, and paying for our research for 10 years. I mean, we are significantly invested, because here is the deal. We have Americans not only suffering, we have Americans losing their lives at the hands of a United States federal rule. We have mental disorder. These things lead to you losing your independence. These cancers are leading to deaths. That's a bold statement, but I'm standing by it.
Yeah, no, it's you're again, you're seeing absolutely everything that, let's say, people in the health industry are seeing, is that these pathogens lead to all manner of disease. And again, if you're living right on top of a big mound of pathogens, that's going to make you super sick, regardless of what the federal rule says. So what are you guys doing as far as trying to change the federal rule? And then are you like working with the HHS? So what would be your call to action? What would be your path forward, that you would want to kind of leave people with, and, kind of what you're doing right now to change this?
We've activated several things, and I appreciate that invitation to invite other people into our work. We are at that launching point where we've built the most robust toolbox ever, not just by a family or an entity, but across anybody's work. We have the most robust toolbox connecting the sludge to a public health crisis in our nation. I felt like our next jumping point has to be public awareness, and I'm asking for a meeting with the President of the United States. We've put out a video that demonstrates what we're doing. We have the best drone footage on the planet that shows the nation what we're doing. We've demonstrated how the 503 rule works, the health impact of a community that has been inflicted with sewage for decades, since at least the early 80s, possibly earlier, in Northeast Oklahoma County. We are asking for a meeting with President Trump. This is a nonpartisan matter, by the way. We want to present facts to him and solutions. The solutions do not lie only in policy. If we do not have wastewater infrastructure to properly manage sewage solids, it doesn't matter what your policy is. Putting sewage on our nation's soil in any shape or form is a disaster on the health of our people. And that is not okay with me. I'm asking people, find us on social media. You'll find us under Mission 503 across most social media. Go to our website, get informed, get involved. On our Get Involved page, we're asking people sign our petition, make a donation. We're asking for $5.03 from everybody. This is an expensive endeavor. We don't regret a penny of it. But to get to the next level, we would love some support. We've got t-shirts, great t-shirts right here.
Nice t-shirts.
For sale on our website.
Okay.
But if people will find us on social media and on YouTube, find that video that we just released. It's called An Open Video Letter to President Trump, Secretary Kennedy, and the American People. It's 10 minutes. We have wrapped this thing up in 10 minutes. I need everybody watching it, sharing it, advocating for change, advocating for us to get this meeting with the president, because we will demonstrate it's worth it to invest in infrastructure change, because the cost we are inflicting on the American people is far greater than any cost to change our infrastructure.
Yeah. So, Paula, I want to congratulate everything that you guys have done. I know, it's been a great personal expense, everything that you guys have put together. But thank you so much for being on today and really helping us understand, what Mission 503 is, what you all's mission is, and ways that we can get involved and help you. And again, everybody listening to this, nothing happens here unless you get involved, right? Paula and her family have drugged this about, as far as it can possibly be, taken by a single family and probably a group of people that are standing behind you. But now this needs bigger support. So now this needs everyone to get involved. So Paula, do you have anything you want to leave it with here today?
I would just say only by the grace of God have we gotten here, and the collaborating researchers across the nation that have been willing to boldly work with the family that they believed us. They trusted what we were saying. It's just time. If we want to make America healthy again, we can no longer dump our nation's sewage where millions of Americans live. And we're asking, join us. Join us. You can email me. Go to our website. All my contact information is on there. Find us on social media. We will connect with you. But we are asking for people to get engaged with us now. Help us get to that next level.
Very good. Well, Paula, thank you so much for being on today. This is a wonderful segment. We completely support your mission and what you're about. And we want to drive as much interest to it as we possibly can. Because like you said, we can't make America healthy again if we're dumping poop on ourselves. That's just insanity. So thank you again. And thank you for everything that you do. A lot of people won't thank you for what you do, but I know the personal sacrifice and everything that you've gone through. And so does Cindy. So thank you on behalf personally and on behalf of, humanity. Thank you.
Thank you for what you're doing and the forum that you create. It's very important, and we really appreciate it.
Thank you. Thank you. So we'll leave it there, and we'll see you guys back. Okay. We'll be back with another Truth in Health podcast where we have another exciting guest with another big topic. Like Paula, you guys get out there, go to Paula's website. It's right down there at the bottom. Check it out, get involved, help her. This costs a lot of money to do stuff like this. So if you can help her with a donation or buy a t-shirt, that is going to be greatly appreciated, and the money will go directly to this cause. So again, Paula, thank you so much for being here, and we will leave it here for now.
Thank you.